Will the Affordable Care Act survive Trump 2.0? No. Hello, I'm Kevin Knaus with InsureMeKevin.com, an independent health insurance agent and certified with Covered California to enroll individuals and families into Affordable Care Act subsidized health insurance. And I've been doing that since 2014 with Covered California. So I have seen the Affordable Care Act through the Obama, the Trump, the Biden years, and now it looks like we're flipping back to the Trump years. So when I make my prediction that the Affordable Care Act will kind of go away or be completely reimagined, it is based on my observations of these last 10 years. First, Donald Trump. Donald Trump really doesn't care about individual and family health insurance. He has Medicare. So I don't think he's ever really cared about the affordability of health insurance. Those people around him do care about the Affordable Care Act, and the one thing he has in common with them is he doesn't like anything that has Obama's name attached to it, Obamacare. So that has to go. And when I look at the people around him and what they are thinking about for any subsidized health insurance, I turn to Project 2025, Chapter 14 on the Department of Health and Human Services that outlines how they want to radically change the Department of Health and Human Services, and that department oversees the Affordable Care Act. So first, I do want to remind people what the Affordable Care Act is and how it mandated certain things for the health plans to be eligible for the subsidies. So a health plan has to have 10 minimum essential coverage benefits, outpatient services, emergency, hospitalization, pregnancy, mental health and substance abuse, prescription drug coverage, physical therapy, lab services, preventive and wellness services, pediatric services, and birth control and breastfeeding coverage. Now, those have to be in the plans for the plan to be eligible to be subsidized. And there's a few other conditions that are consumer protections. First, there is the no pre-existing conditions clause. So you can't deny someone coverage if they have a pre-existing condition. No cap on healthcare plan coverage for the expenses they pay out for someone's claims. Some before the ACA, there might have been a $500,000 cap on how much the health plan would pay. It can't have that. There are set metal tiers, bronze, silver, gold, and platinum, and those help people compare the different plans because they have to be kind of standard. And so they know it helps them guide them in what they need and what is best for them and their family. And that helped reduce some of the confusion that was in the marketplace. And there was one interesting part called the medical loss ratio, and it states that 80% of the health plan's premiums, the revenue, must be funneled back into healthcare services and innovation. And so that forced the health insurance companies to put the money into the healthcare services and not divert it to CEO salaries. So now let's look at how the Affordable Care Act will be abolished and changed. And my observations are from Project 2025, Chapter 14, that is written by Roger Severino. Actually, within that chapter, he doesn't talk a lot about the Affordable Care Act. He has a few kind of vague outlines in some of the paragraphs, things like allow doctors to contract with patients, revised No Surprise Act, remove dispute resolution, binding arbitration, and most lawyers, which I believe Mr. Severino is, they don't like binding arbitration. They want to be able to sue. They want to go right to court because that's how they make their money. A separate exchange for non-subsidized plans. That's a bad thing because it takes healthy people away from plans, and expand association plans and short-term medical policies, which can be kind of junk, pre-existing conditions and things like that. But the bulk of Steve Rhino's chapter really focuses on banning abortion and making sure that the Health and Human Services Department doesn't do anything to help anyone get an abortion, erase LGBTQ people from any mention. He just wants them to go away. No special services or recognition. And oddly, he wants to avenge Fauci for the COVID mask mandates and vaccines. It was kind of an odd list of grievances. But, so Steve Rhino, you talked about, making sure that abortion pills couldn't go across state line. And, we had to get rid of that chemical abortion. Religious objections, making sure that providers could discriminate on the basis of their religion, and making sure that their feelings weren't hurt when they had to provide a service that they didn't like an abortion. He just doesn't like any mention of the LGBTQ community within the Health and Human Services, so he wants to get rid of that. Bring back discrimination. Now, there is a section within the Affordable Care Act called Section 1557, which is, says you cannot discriminate. Providers, me as an agent, cannot discriminate on the basis of race, color, ethnicity, sex. And it was interpreted under the Obama administration to mean that you could not discriminate on the basis of someone's sexual identity or gender identity. Okay. When Trump got in, HHS reversed that. So you could discriminate. Biden comes in, they flipped it back. So, and that was just one of the ways the Trump administration tried to change the Affordable Care Act within the rules, because they couldn't outright abolish it and start from new. So when I look at Steve Rhino's chapter 14 and all of his grievances, and with the understanding that there probably will be some sort of subsidized health plan, but they're going to set it up so that no plan that doesn't meet their specific criteria will get subsidies. And what is the criteria? What are the conditions? I believe they will not subsidize any plan that has any coverage for abortion-related services, or, either physical abortion or getting the pills, okay? You won't be able to get a subsidized plan that has that in it. They will probably make sure that there is no mention and removal of any LGBTQ healthcare services, really focused on transgender services for those individuals. If there's any coverage in there or any hint of it, I'm sure it won't be subsidized. And they'll probably, if the health plan has any mention that they won't discriminate, they probably won't allow subsidy for that, because they have this thing about religious freedom and allowing providers to just say, no, I don't like your religion, I don't want to treat you. It's very odd. But if the health plans that are offered have any of those, abortion or LGBT services in it, it won't be allowed to receive a subsidy. So what will the marketplace look like? Well, again, I do believe there will be some sort of subsidized health plans in the marketplace. I mean, even Republicans realize that health insurance is very expensive for a number of reasons, and it doesn't always have to do with the health insurance company. But I do believe we'll see lower subsidies. They're not going to be as generous. It may go back to less than even the original Affordable Care Act before the Inflation and Reduction Act of Biden that really enhanced the subsidies. I believe we'll see more junk plans, the ones that are allowed to be enrolled in through for short-term and association plans, those plans that can put in a pre-existing clause, yeah, sure, sign up, but if you've had cancer, we're never ever going to cover cancer if it comes back. We're just not going to do it. I believe we'll see more plans with gaps and caps. The gaps being removing those minimum essential coverage benefits. Like we'll see plans with no maternity, no prescription drug coverage, no mental health coverage. And those are the type of plans we saw before the ACA. And I would get a call from the woman saying, I just found out the plan I enrolled in 2 years ago has no maternity coverage and I'm pregnant. What can you do? There's nothing. That's why the ACA came along and got rid of those plans, but I think we'll see them return. The caps are how much the health plan will pay for certain services. Maybe they'll only pay $10,000 for one sort of healthcare service, and maybe cancer treatments will be capped at $250,000 or something like that. But of course, a cancer treatment could be way more than that. So I think we're going to see some caps come back into some of these health plans. Death spiral for some markets. And the death spiral is when you create a dual track of health plans and allow the healthy people to leave health plans and go to these catastrophic health plans with maybe no maternity coverage, no prescription drug coverage, pre-existing condition clauses, and you're leaving people with healthcare challenges in the subsidized plans. And so there are more claims, less premiums, and then the premiums have to go up to cover the claims, and then it gets so expensive that people have to drop the health plan, and as more people drop it, the whole health plan collapses. It's just a death spiral. We'll probably see some of that. We see that in the grandfathered plans now, pre-ACA, where there's just so few people in it that they have to close it because they can't generate enough premium dollars to cover the health insurance claims. And the saddest part of abolishing the Affordable Care Act is the expanded Medicaid. And in California, expanded Medi-Cal covers, at least 5 million children and adults. If your income is below 138% of the federal poverty line, Medi-Cal in your county, zero cost healthcare services, zero cost on the prescriptions. It has been a lifesaver, literally a lifesaver for people who have had cancer, heart attacks, people living in poverty. And that will go away, and it's going to be very hard to backfill that gap on the state level. And that's very, very sad. So I do not believe that will survive in Trump's term. So my recommendations for you, if you have the opportunity to get into an Affordable Care Act plan with subsidies for 2025, you should do it, because this will all hit in 2026. Get into one of the good plans, get the subsidy, get some health care, get healthy, because in 2026, I don't think those plans are going to be around, and if some of them are, there's going to be a lot of restrictions, and the subsidies won't be as generous, and you may not be able to afford that good health insurance plan. So if you have any comments or questions, you may leave those down below, and I will do my best to answer them. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.